John, thank you for having me. Actually, it's a great question. I heard some of the experts you interviewed talking about the traditional Chinese medicine approach, which is slightly differently from the Western medicine. The key difference, in my view, which, I'm trained in Western medicine, but I'm Chinese, I learned a lot about TCM as well, is the key difference is this so-called integrative view or the holistic view, which is lacking in the current conventional Western medicine. So to speak, for example, COVID-19. If you look at worldwide, particularly in the United States, the policy has been primarily of vaccine plus mask plus lockdown. You don't really hear much about the promotion of boosting your own immunity. We all understand, we all know it's common sense. I'm willing to debate with anybody. The top experts, Dr. Fauci himself worldwide, is about this approach. We need to strengthen our own immunity against diseases, COVID-19 included. And so how we do that? This is integrative approach by living a healthy lifestyle and exercise, eating healthy diets, boost your nutritional immunity in particular, because that is the key protective force that prevents us from getting diseases. Only killing the virus itself is only part of the thing. So I've been saying the vaccine mask lockdown policy is an incomplete policy, and which needs to be updated. And I cannot believe the national level, a federal level policy which is incomplete. And the average doctor like me can think of a more complete policy. They don't talk about it, which is, to be honest with you, less than satisfactory.
Now, Richard, why do you think this push towards TCM is coming now? Why now?
Well, actually, that's a good question, John. Is that worldwide, on the mainstream media, you may hear still talk more about vaccine or these other things. However, the consumers, we know. One of the best things coming out of the great COVID-19 tragedy is that consumers are waking up. They realize that the vaccine, mask, and lockdown approach is only partial, is not really helping. We need to boost our own immunity. Because I'm so busy. I've been so busy for the last year and a half or so on consulting, giving lectures, seminars, is because consumers need it. And that is the beauty. Why TCM is because, like in any other industry, it's the consumers that drive the market. So when consumers wake up, the leaders will listen, including industry leaders.
And are there enough people around the world, do you think, who are interested in TCM to take it up as something that they practice in order to make this push worthwhile globally?
Great question, John, actually. You know what? TCM in the United States is not new. For example, NIH. When I was a physician at NIH back in the 1990s, and I think they established an office for alternative medicine back when I was there in the 1990s.
Right.
And also in the United States, you may have heard that there are these new medical thinkings. One of the most popular ones is so-called functional medicine, which I'm also myself is a functional medicine physician. Basically what happened is that probably around the 1980s or 1990s, there was a boom of doctors who were seeking how to better treat diseases from learning from other, for example, Chinese medicine, Indian medicine, local Native American medicine, or these other, traditional medical thinkings. Basically, so TCM, although the name is not necessarily reflected in the functional medicine per se, however, this philosophy, this logic is fully reflected in the functional medicine and many other, for example, anti-aging medicine. So yes, it's not new.
Thank you very much. We appreciate it. We'll talk to you again soon. Thank you. Thank you.
I'd like to get one second. Consumer listeners, please. You live in a healthy lifestyle, take a lot of vitamin C, under doctor's advice, vitamin C, vitamin D. These things will boost your immunity. You will survive this tragedy.